Welcome to American Medical Review. I'm Morley Safer. Man's quest to combat disease and extend and improve the quality of human life has led to centuries of advancements in healthcare. And perhaps the most significant strides are those that have been made in our own time. Here's one of the latest developments.
Its victims can be too embarrassed to seek help. All too often, it's the subject of insensitive jokes made around the water cooler. But the millions of men who suffer from male sexual dysfunction know it is no laughing matter.
Male sexual dysfunction has come to the forefront in the past 10 to 15 years, and a great deal of research has been performed according to the problems that males face. The two main areas that males have problems with are erectile dysfunction and premature ejaculation, and/or a combination of both, which may manifest itself later on during their dysfunctional time period.
Much of this research has focused on the recent introduction of several effective and popular drugs for ED. However, these medications are not for everyone. In fact, they're often contraindicated for men with heart disease, high blood pressure, and diabetes, who make up a large percentage of the population suffering from impotence.
If there were one pill that would solve all of everyone's sexual dysfunction problems, then that would be certainly not only convenient and easy, but it would be very unique. The problems can be rather complex, and aside from the physical problems, then you have to also consider the emotional and mental problems that weigh and become a main part of the sexual dysfunction process in men.
Just as the presenting symptoms of ED vary from patient to patient, so can their causes. However, no matter what the cause, all cases involve the restriction of blood flow to the appropriate vessels. Here at a clinic run by the Boston Medical Group, doctors are taking a broad approach to the problem that directly addresses this fact. A complete medical exam is performed, including the latest in state-of-the-art diagnostics, before any therapy is prescribed.
The diagnostic workup includes such things as measuring nerve conduction within the patient, and also measuring the blood flow of the patient by echodoppler means, so that we can get a picture of the basis for the patient's problem, and then go from there. Now, that does not exclude such things as a good patient history, because some patients not only have a physical problem, but they have a great deal of mental overlay affecting their overall problem.
Once properly diagnosed, a course of treatment is recommended that usually includes the direct application of a combination of FDA-approved vasodilators, medications proven to open vessels and improve blood flow. Like most who come to the clinic, John Runde made an appointment after speaking to one of the trained telephone counselors.
Well, obviously, I didn't want everybody to know that I had this particular problem. And so privacy was extremely important to me. Maybe I was a little bit overly sensitive about it. But when I did come to the clinic, I was treated with a great deal of respect and understanding. And also, they made me feel like I wasn't being singled out.
The emotional toll that is exhibited in patients who have male sexual dysfunction affects not only the patient and their relationships, but also affects their inner feelings about themselves in terms of their own self-esteem, in terms of their own feelings of adequacy, in terms of their performance parameters. The treatment modalities for patients who have sexual dysfunction should include and encompass the emotional aspect of these patients' problems.
It's well known that many physical conditions can also bring with them emotional anguish. Medical science that can help improve one's love life may also renew a love of life.
Advances like these give us hope for a healthier tomorrow. Thanks for joining American Medical Review. I'm Morley Safer.
For more information, call American Medical Review at 1-800-880-8485 or log on to WJMKTV.com.